Good evening, everyone. This is Meldita and I'm back. Welcome to my YouTube channel, Meldita's Info Corner. And this is my Facebook, johnregacho@yahoo.ca. Okay, as I promised, there will be a brief videos about connection and during connection and after connection, steps to follow prior to, the use of our hemodialysis machine. Okay, so in this case, what are the steps to follow before hemodialysis machine? What are the steps to follow? Okay, so we have here using PermaCath, or we're gonna use the AV fistula. Okay, so this is AV fistula, and you know that there's an anastomosis here, the artery, anastomosis between the artery and the vein, and this is the catheter coming from the anastomosis area. This is going to the dialyzer. Okay, this is our dialyzer here. Okay, and there is also a tube going back to the patient from the dialyzer. And this is the PermaCath. Okay, so let's start. So here we go. So I have here, so let's say I'm gonna use first the, so actually we are now on recirculation. So the recirculation is ongoing and the machine is on. So that is the connection between the arterial and the venous tubing. So that is recirculation, which is ongoing. Okay, so let's assume we're gonna start the AV fistula. In the AV fistula here, the patient is taught in the hospital to do buttonhole. So the patient will poke this part here. This is the one that is, this is where the arterial line needle is coming from, going to the dialyzer, okay? And in here, the patient will put tourniquet. Okay, there's a tourniquet in the arm, and the patient got already the buttonhole there. And then we'll aspirate here. So we'll aspirate blood, open the clamp, aspirate the blood, and let's say you got the blood like about maybe, so you do it a few times, flush, and then you have to aspirate the blood, and then flush it, aspirate, and then flush it, aspirate, and then you can actually flush like this. So you have to like, in pushing the blood back, push, stop, push, stop, push, stop. You do it several times, maybe 3 times, and you clear up the tubing, and that's good actually, during dialysis. Okay, when that is finished, you clamp it, and then now you follow that with a flush. You're gonna use this flush, and all the way down, you flush it, okay, and then clamp back again. Okay, so that is actually connected now to this tubing in here. Okay, so that is connected, and then you clamp it. Okay, then the same thing with the other one. You get again a 10cc syringe. Okay, you insert this one, open the clamp, and then try to aspirate the blood. The tourniquet remains, aspirate the blood, and then aspirate the blood here. You push, stop, push, stop, push, stop. You do this several times to clear up. And when it is finished, okay, so you push, you aspirate the blood, you push, stop, push, stop, push, stop. That one, you do that several times, clamp it, you're done, okay? Then after that, you follow that with 20 cc's of normal saline to flush it, and you are done. Okay, so that's about it. Now let us assume, so you see that this anastomosis, this is where the arterial line is connected, okay? And this one here is the venous line. This is the connection. So blood coming from the anastomosis area, it goes to the dialyzer, and then from the dialyzer, the blood goes back to this venous line here. So that's why they call it the vein-to-vein connection. Okay, let us assume the patient will use here the PermaCath. So the PermaCath here, we got 2 tubings in here. So we got the venous line and the arterial line. And again, we got to start flushing, preparing the line again. Okay, so in this case, I will use this arc line here. So to do that, of course, you keep using all this, using aseptic technique. This is just a demo. It's not a perfect job to do, but just to have an idea what it's all about it. And again, I will push this. I will put this syringe in here. Clamp is open, okay? And now you got to remove a total of 3 cc's of blood, and that is mixed with our sodium citrate, which is actually used at the end of the dialysis. This is a blood thinner, okay? So we take 2.2 plus another one, total of 3 cc's. Once you get that one, okay, you clamp it, you got 3 cc's, and then follow that with this 10cc syringe. You aspirate the blood, let's say you fill up until like about maybe, let's say 8, and then push, stop, push, stop, push, stop, push and stop, and you create the turbulence of blood flow so that you clear up the tubing inner lining. Okay, so you do this like probably 3 times. Okay, when it is done, you follow that with flush, and this is 20 cc's of normal saline. Again, you got to proceed to the other one. So this is the arterial line connection, and we're gonna go to the venous line. The same thing. You got to remove the total of 3 cc. That includes our sodium citrate. Okay, once you get that one, you follow that with a 10 cc syringe, and again, you aspirate the blood. Let's say you take like about 6 or 7 or 8 cc's, and when you push the blood, it should be push and stop, push, stop, push, stop, like this, and you do this, let's say 3 times, so that you help out in clearing the inner part of the tubing. Okay, so that's about it. And after that one, okay, clamp, and then clamp that one, and get your 20 cc's of normal saline, and then you push all the way down in here, and after you finish, clamp it, and then you're ready for connection.